Hi, I'm Dr. Sia, and one of the therapies we're going to commonly be looking at here on the Dr. Sia channel is intensive short-term dynamic psychotherapy, ISTDP. Now, you might be wondering, why are we going to be looking at this therapy? Well, I love this therapy. It's such a useful therapy. It's such a humanistic therapy. It's such a therapy that really gathers and collects all of aspects that are important for as a human being and for a human being for us to look at together. It looks at values, it looks at beliefs, it looks at awareness and thoughts and feelings, and just as a fantastic therapy. And I can't stop raving about it enough, but let me help you understand what it is. So intensive short-term dynamic psychotherapy, or ISTDP, is based on one of the oldest therapies that we know of, which is psychodynamic therapy or psychoanalytic therapy. So over time, as it became more and more developed and new people came along, so psychoanalytic therapy was developed by someone you might have heard of before, Freud, Sigmund Freud. But over time, obviously, a lot of other scientists have added to it. And one scientist that added to it that was really important was Bowlby, who added attachment theory to this idea of psychodynamic thinking. And then finally, the developer of ISTDP is a professor in Canada at the moment. I believe he is Professor Habib Davanloo. So what is it about this therapy that makes it so special? Well, I believe one of the things is, firstly, it's based on a lot of healthy, solid theory about human development, about how problems begin, about how problems happen for us, and how we can solve those problems. So it's a really holistic therapy that also considers the positive psychology of things like gratitude and optimism and hopefulness. It's a therapy that doesn't just aim to remove a problem, but really it's a therapy that aims for people to have a good quality of life, to live well. It's one of the only therapies that truly believes that problems can be removed altogether and that people can have happy, thriving lives without anxiety. So how does it aim to achieve that? Well, what ISTDP says is that problems happen when we're very, very young. And when we're just little children, and things go very wrong for us, perhaps through our parents or our caregivers not being able to give us what we need, not just once or twice, but persistently and consistently miss out on our needs, then over time we have these wounds within us. And we have this pain and this hurt that sits within us. And what the point of ISTDP is to help us see what that pain is, what kind of things we're doing to get away from that pain, and whether we can find a way that's healthier than constantly looking away from the pain. So that might sound a little bit difficult to get. So let me just put that in an example. Say, for example, when a person comes to therapy and when they're a child, they get overly criticized by their parents. I'm not talking about once or twice, but maybe they have a parent who's persistently critical and only gives them attention when they're being critical. Fast forward 30 years, and this person now has this wound inside them where they may believe that ultimately they are not good enough as people. Well, and when they're in social situations, they tend to reject people, not let anyone come close enough, keep people outside of their emotional sort of selves, because they believe if people get too close, then they'll see that they are maybe not good enough. Right? What ISTDP helps the person do is to go, look, maybe we can just look at this idea that you're not good enough. Maybe if we just remove this idea that you're not good enough, see what happens underneath. What would happen if you believed that you're good enough? And then the person might feel a lot of hurt and pain that came from their childhood about when they started believing that perhaps they weren't. So it means that when we talk about pain here, it's the pain of feeling what it felt like when they were a kid, being criticized and rejected by their father. If we can do that and overcome that, then the person won't feel anymore like they need to push people away in their current life. They'll understand that that pain was just the pain of a child being rejected by their father. They don't need to feel that pain anymore. They can be open to new people, to new experiences, and won't feel anxious in situations where people want to connect with them. That's one of the reasons I think ISTDP is such a beautiful therapy, because it doesn't just want to solve some of the problems right now. It's not a band-aid type therapy. It's a therapy that gets in there, rips out the root of issues, and really helps you make useful, beneficial changes in your life. Now, it's impossible for me to talk about everything that ISTDP is without boring you throughout this video. So if you are curious about it, keep watching some of the videos in this link. I'll be talking more about what ISTDP is, but also go ahead and pick up a book on what is intensive short-term dynamic psychotherapy. There are so many good authors out there. John Fredrickson, Alan Abbas, Habib Davanloo, Patricia Coughlin. I could keep going on forever. Nat Kuhn. Look, pick up a book, have a read about it, or just Google what it is. If you have any more questions, anything you'd like me to talk about here in the video, just put something down in the comments. I'm more than happy to make a video about it. Please subscribe. Please like this video. And remember, if there's anything else that you want me to talk about, just let me know. All right. Thank you. I'll give you 2-3 seconds to go and subscribe right now. I'm just gonna watch, hover over your shoulder as you go and do it. Yeah, right down there. Thank you. Okay. See you next time.